Hey, future nurses, today we're tackling a condition you'll see time and time again in your practice: anemia. From iron deficiency to sickle cell anemia, we'll break down each type, its causes, symptoms, diagnosis, and treatment. Remember, this video is a study guide, not a replacement for your textbooks and lectures. Let's get started. First up is iron deficiency anemia, the most common type you'll encounter. Without enough iron, your body can't make enough healthy red blood cells to transport oxygen effectively. Causes include poor diet, blood loss from heavy periods or gastrointestinal bleeding, and frequent blood donation. Symptoms include fatigue, weakness, pale skin, shortness of breath, headaches, dizziness, and chest pain. Next, let's talk about vitamin B12 deficiency anemia. B12 relies on a special protein called intrinsic factor, made in the stomach for absorption. Conditions like pernicious anemia can hinder this process. Besides typical anemia symptoms, B12 deficiency can cause neurological problems like tingling, numbness, difficulty walking, and memory issues. Now let's move on to folic acid deficiency anemia. Folic acid is essential for DNA synthesis and red blood cell production. Not getting enough folate in your diet, especially during pregnancy, is a common cause. Certain medications can also interfere with folate absorption. Symptoms are similar to B12 deficiency, but without the neurological issues: fatigue, weakness, pale skin, and shortness of breath. Now let's delve into aplastic anemia, a rare but serious condition. In aplastic anemia, the bone marrow fails to produce enough red blood cells, white blood cells, and platelets, often due to autoimmune disorders, toxins, or viral infections. Patients are at increased risk of infections, bleeding, and fatigue. Next up is hemolytic anemia, where red blood cells are destroyed prematurely. Causes include inherited disorders like sickle cell anemia and thalassemia, autoimmune diseases, infections, or certain medications. A telltale sign is jaundice, caused by the buildup of bilirubin from red blood cell breakdown. Let's talk about sickle cell anemia, an inherited blood disorder. A genetic mutation causes red blood cells to become rigid and sickle-shaped, blocking blood flow and causing severe pain episodes called vaso-occlusive crises. Sickle cell anemia is most common in people of African, Hispanic, Mediterranean, and Middle Eastern descent. Symptoms often appear in early childhood and include excruciating pain crises. Next we have thalassemia, a group of inherited blood disorders affecting hemoglobin production. The body doesn't produce enough alpha or beta globin chains, essential components of hemoglobin. Severity ranges from mild to severe, with symptoms like fatigue, weakness, pale skin, and shortness of breath. Severe cases may require regular blood transfusions. Finally, let's discuss anemia of chronic disease, often a complication of long-term health conditions like chronic infections, inflammatory disorders, or kidney disease. The underlying disease interferes with the body's ability to use iron effectively, leading to decreased red blood cell production. Symptoms are typically mild but can worsen the fatigue and weakness associated with the underlying condition. And there you have it, a crash course on the different types of anemia you'll encounter as nurses. By mastering the characteristics, causes, symptoms, and treatments of these anemias, you'll be well prepared for the NCLEX exam and your future nursing practice. Keep those brains fueled with knowledge, and I'll catch you in the next video.